I'm Alexander Stratigos. I'm a dermatologist, venerologist. I'm an associate professor at the University of Athens, and I'm based in Andreas Ingros Hospital, which is a major referral center for skin disease in Greece. Skin cancer is a major public health issue. It is the most common type of cancer that affects humans, and even though sometimes we tend to underestimate its importance because it's a curable tumor in most of the cases. However, the number of patients and cases diagnosed every year in my country and in whole of Europe is a very big number. In addition, some forms of cancer, such as melanoma, are tumors that can have a very aggressive and even fatal course. So obviously, different forms of cancer have different degrees of aggressiveness and associated mortality. But certainly, as a whole, the problem of skin cancer is a very big problem, and I expect this to become even a worse problem in the future as the cases certainly tend to increase in number. Well, I think that there are other, first of all, medical groups and doctors, apart from dermatologists, who are definitely important in the combat against skin cancer. For example, primary care physicians, internists, family practitioners, people who get in touch with their patients every day and are able to inspect their skin and possibly diagnose skin cancer. So this is an important group. And then in terms of non-medical groups or practitioners, certainly you mentioned some of them, like hairdressers, for example, or physical therapists, or people who are involved in general skincare, are people who are daily in touch with people and are able to inspect and observe the skin. So I think training these people, making them aware of the potential alarming signs of skin cancer, will definitely make them in a better position to help diagnose these cases early enough before they become more aggressive or more advanced or even fatal. I think that most patients, when they are diagnosed with skin cancer, they become alarmed, and they definitely want to have the tumor removed as soon as possible. So they're very, I think, disciplined and will follow the medical directions very closely, and most of them will definitely collaborate and cooperate with the physician in order to manage the problem as effectively as possible. There are always going to be those cases who might be a little bit more negligent, will neglect the advice of the physician, who will maybe visit other physicians to get a different diagnosis. But certainly in the majority of cases, I think there's a very good tendency to collaborate with the physician and treat the tumor as best as possible.